There is a need now in our community, an investment toward the future of our community, and the opportunity for you to help. East Central Indiana Casa is in need of Casas. So your next question might be, what is a Casa? Well, that was ours too. So we asked Annette Craycraft, the executive director at East Central Indiana Casa.
CASA stands for Court Appointed Special Advocate for Children. Basically, we are advocates for those children in our community who are abused and neglected. They aren't children who have done anything wrong on their own. They're children who have been harmed by their parent, their guardian, or a caregiver.
How unrecognized is that problem in our community in comparison with the way it really is?
It is very unrecognized. I always say that we're Madison County's best kept secret as a nonprofit because we do so much to help children in the community, but a lot of people aren't aware of us unless you've been involved with us. We rank currently about 5th in the state of Indiana for child abuse and neglect, and a lot of people don't realize that. They don't realize the severity of the problem here in Madison County. And so it's always troubling to me when I talk to individuals, but I'm glad that I have that opportunity to kind of wake them up to what's happening in their backyard. We see a lot of abuse and neglect due to mental health issues with families. Drug abuse obviously is very rampant right now. Even through the pandemic, a lot of abuse that even went unrecognized because the children weren't going to school as often, and they're our number one reporters in the child abuse system. So we do have a very significant problem here in our community.
If you were to take a snapshot of how things were 10 years ago, 5 years ago, even 2 years ago, how do we compare today with those different time periods? Are we gaining any progress? Or are the numbers getting worse?
The numbers in Madison County, unfortunately, are getting worse. I started this position about 16 years ago, and about year after year, they have stair-stepped and the problem has increased. And there are various reasons for that, and I often, hypothesize about it and try to come up with why I think this is happening. I do think a lot of it still ties back to the economy. When you don't have jobs that are paying a fair wage, people don't have health care, they tend to start self-medicating, or they can't get the mental health treatment that they need. It's hard for single mothers to afford childcare. And so that's when we see them leaving children with boyfriends who maybe they've only known for a week. And we've had a lot of serious abuse situations in our community due to mom's partners, just because she had to go to work and there was no place to take your kid when you work the 6 to 10 shift at a pancake house or something. So I think a lot ties back to that. But it increases year after year. I want to say we've been 5th in the state probably for the last 6 years. So I would say probably in the last 10 years is when I really have seen an uptick in the number of cases that we have here.
How does CASA enter the equation, and what happens once the problem is identified and CASA enters?
Well, here in the state of Indiana, a lot of people don't realize this, but we are all mandated reporters. So if anyone ever suspects child abuse or neglect, I have to say, be sure that you report it. I know people are always hesitant to get involved, but you do that anonymously. No one would ever know. And so once a report is made to the DCS hotline, and that's the Department of Child Services, or a lot of people refer to it as the Welfare Department, because back in the day, that's what it was called. When a report is filed there and DCS gets involved and does an assessment, when they file an open case on that child or that family, it is called a child in need of services. And so when they file that with the court, CASA is automatically appointed to that case. And then that's when our involvement begins with the case.
Most of your visible members are volunteers.
Correct.
So tell me about the life in the day of a volunteer CASA worker.
It varies from casa to casa. We have casas who have a variety of cases. When you first are trained, the training is a really intensive part because we want you to have all the tools necessary to do this work. We don't want to just throw you out there. So that's the first big step, is to attend the training. And then once you get a case, you have the flexibility to work this case on your own time frame that works well for you. If you're a night owl, you can do a lot of work at night, or you can do it on the weekends. And so If they're a worker, or a stay-at-home mom, they may do a lot of that work on off hours. The one thing that is mandatory is to attend court. That's during, office time. So an advocate, when they get the case, they may first meet with the DCS worker who's working with them on this case and get some background info that way. There are sometimes provider meetings or case and family team meetings that they want to attend. They may come here to the office to staff questions with their supervisor. There's always someone here that supervises that volunteer and guides them. And then they will get a lot of information. A big part of being an advocate is being a fact finder and kind of like an investigator. So you get a lot of information about that case that you will take with you and spend a lot of time researching and sorting through that to see how you can come up with the best recommendations for that child. And we want to recommend what's in that child's best interest.
So to differentiate, you're not the same thing as a DCS worker.
Correct. We're very different. A DCS worker is, Department of Child Services is a government entity, and by state law, they are working to provide services to the family to try to reunify and bring that family back together. And we all realize if you can bring that family back together, that's the best case scenario for everyone all around. But sometimes that's not going to happen. There are various factors where we know early on that may not happen. And a Casa volunteer is there to solely look out for the children's best interest, not for mom or dad's or anyone else's. We're solely looking out for that child's best interest. And when we give recommendations to the judge, that's all that we focus on, where the department, again, is providing services and other avenues to help that family to try to bring them back together.
Obviously not identifying any individual cases, but let's talk about some of the success stories that you've seen Casa realize through their advocacy.
We have had, like I said, I've been here for 16 years, so I could probably think of several, but we've had cases, like I like to tell one case, it was very simple. A young child wanted to see their dog. That was the one thing that they missed when they were removed from the home. I mean, the one thing people need to remember is that these children don't do anything wrong, but their lives then are kind of turned into upheaval. Like they're the ones taken out of their home and changed schools and pulled away from their pets and siblings. And so it's almost like they're being punished. Sometimes they feel that way. And so we had one child that was all that she wanted. She didn't want to see anybody else but her dog. And so the advocate worked to get a visit with the dog. So something as simple as that to make that child feel well. We have a story actually that we're highlighting on our Facebook page right now of a young man named Kenneth who now is in college at Anderson University doing very well. He was a stellar student, but he tells very openly about his relationship with his Casa and what she did to help him along the way. And he kind of sees her as a grandmother figure, but she really taught him a lot of things and helped him build self-confidence and helped him and reassured him that he could go on to college and he could have these goals. And he attributes a lot of that to his Casa. And we have so many stories like that. Like I said, I've been doing this for so long. We have stories where the Casa sometimes was that one constant person in their life. When you're involved in a massive child welfare system, there are a lot of turnover of service providers, workers, and most often the one person, if you look at these cases that are constantly there, is the Casa.
Number-wise, how is the balance between full-time staff and volunteers? Which is needed more to take care of these responsibilities?
So all of the above is needed. We have a staff of about 15 people. I will say about 10 are full-time. Possibly, I could be a little off, and the rest are part-time. We have 3 volunteer supervisors who currently supervise about 50 volunteers. So they divide up that caseload. Our volunteer numbers are down a little bit now, which is why we're trying to create awareness in the community and create awareness about the need that we have. The pandemic, we really took a hit too, because I think a lot of people wanted to volunteer during that time because they had more free time, but it was very difficult because because a lot of us were kept at home and things like that. So we truly need more volunteers. The volunteers are the meat and potatoes of this program. I could hire, if I had unlimited funds, I could hire staff to do this work, but it is so meaningful to these children when it's a volunteer working with them. It resonates so much when the volunteer meets them and tells them, I'm volunteering my time to be with you and to do this with you. And it's not just another paid worker. As I mentioned before, they have a lot of paid workers in and out of their lives. So to have somebody just say, I'm doing this because I care about you, means so much to them. And the volunteers also, it's very cost efficient for the program. We do have to train them and supervise them, but you don't have to pay them an hourly wage. And so overall, when we're mandated to be on these cases, it really does save the community a lot of money to have volunteers.
Could you speak to some of the feedback that you've gotten from volunteers after they have experienced some of the face-to-face situations that they have?
You know, we just had book club last night. We have a volunteer book club where we read books, about the work that we do. And, I heard some of that last night where they were talking about how much it means to them when that child first starts trusting them. Because when you first go into a home, the child may be closed off. They don't trust adults at that point. And so when that child first starts building trust with them and opens up, that is so impactful to them. It really hits home, and what they're doing is how important that is. When we work, either if we see a successful outcome because the families reunited and we were able to be a part of that, that really means a lot to the volunteer to know that they were able to do what they could to get that family back together and know that they're now safe and the problem is rectified. And then on the flip side, we sometimes have kids that go up for adoption, and their rights are terminated with the parents. And even though that's a sad process, when you see that child go through an adoption with that loving forever home and they're going to be safe, that's a win for the volunteer as well.
The main theme of this, the reason we're here today, is because volunteers are needed. Let's talk about getting into the program as a volunteer. First of all, it has to be something on your heart. But if you would speak to becoming a volunteer for Casa and how much is needed.
You're right. It has to be something that you just care about children. Folks say, well, I don't have a degree or I don't have a background in that. We have people from all walks of life, homemakers, postal workers, factory workers, all the way up to, college professors. And everybody does a wonderful job. You have something to give. So I never want that to stop anyone. You just have to be a minimum of 21 years of age and obviously pass all background checks since you will be working with children. If you're interested, on our website, which is eastcentralcasa.org, there is a place there where it says something about volunteering. If you click there, you'll see information and facts and questions and answers and those types of things to help you learn a little bit more. And then there's an application there. And in order to volunteer with us, one of the first steps is to fill out an application. And we will be in contact with you to learn a little bit more about you and then set up an interview. And at that time, we can answer even more questions that you have and get you set up for our training.
And speaking of training, how much of that is there?
So the training is about 32 hours total, and it's similar to attending like a college course. You get a syllabus. It's about one night a week for about 4 hours, give or take. Sometimes you get done a little earlier, in about 8 weeks or so. And you'll have all of the tools provided to you that you will need to do this work. You'll have supervisors here also there helping you through this. We teach you how to write reports for the judge, how to investigate and gather the information that you need, information about just child abuse rules and laws in the state of Indiana. And then we also have you do some courtroom observation so you can see what your role is in the courtroom. A lot of people don't realize is that the advocate or the Casa, they play a really big part in that court process. We are parties to the case, which means we have access to everything and we're allowed to give information and ask questions during that hearing. We're one of the only programs in the nation set up this way. And so we want you to kind of see what your role will be during that process.
This is different than a big brother, big sister program, too.
It is correct. You know, we want you to be a friendly face to this child, but you're not there to take the child out to eat and let them have a fun experience. You know, that's important as well. And mentoring is very passionate to me, so I understand that. But you're there to advocate for what's in their best interest. And some of that does cross over a little bit. Like you want the child, especially older youth, to bond with you so they open up, and that is important. But again, you're not there just for fun experiences. You're there to help them through what will likely be the most horrible time in their life. You know, they're removed from their home, they're placed with strangers oftentimes, in new schools, not many supports, and sometimes you're that only support that they have.
Okay, so I always, at the last of this, a call to action.
You've just rolled out a brand new website, so we're very excited about it. So please take a look at that. There are videos out there, and the young man, Kenneth, that I mentioned, there's a video with him and his Casa, and a lot of other information that can give you more tidbits about volunteering. And feel free to reach out to us at any time. And we're here to answer questions and kind of guide you if you're unsure if this is the right fit for you. That's what we're here for. So everybody in the community, again, we need volunteers right now. We have about 400 kids on a waiting list for a volunteer. We have currently about 1,200 cases, and 400 of them need an advocate to be their voice in the courtroom and speak up for their best interest. So if you care about kids, or if you have a calling to make a difference in your community, Casa may be the best place for you. So please visit our website, eastcentralcasa.org, or call us at 765-649-7215, and we can talk to you more about volunteering and how to get involved. And if maybe that's not the right thing for you, we are a nonprofit, and we do take donations that help us serve these children as well.
Annette Craycraft, Executive Director at East Central Indiana Casa. Thanks for your visit today and for what you and the Casas do to make our community a better place to live. Thanks for listening. That's the latest buzz of Madison County.